I cannot stress enough how valuable planning in advance is. So all of the competencies that you need to complete are available on the National School of Healthcare Science curriculum website. Having a look at these early in the programme will enable you to plan forward. So if you see anything throughout your experience that you can use as evidence, you can remember that, keep the evidence and just submit them. My top tip would be planning in advance.
I would say plan. Plan and enjoy what you do. If you don't enjoy what you do, you're going to struggle.
Top tip, definitely keep going. It feels like a real grind sometimes. There are real highlights. Sometimes you're working with a patient and it's just a really encouraging experience. Sometimes something finally clicks and you understand a concept that you've been struggling with, but other times it feels like a real grind where it feels like progress is very slow. So definitely make sure you just keep putting in the time, you'll get there.
Remain motivated and keep pushing yourself into new experiences. For instance, I'm part of my local trainee network and I've been to several conferences already in my first year.
My last slide are some top tips for success. Be collaborative. You will get nowhere if you're not collaborative. You know, no man is an island, I've said it before. You have to work with your colleagues and your patients and talk to one another. You know, as Gemma and Ashley said, there is this STP Perspectives. Get on that blog. It's a great blog. I mean, there's nothing like talking to people if you have a problem. You know, there's hundreds and hundreds of you now, and there's lots of, we have lots of people who've left these programs. Altogether, there's about, 1,500 scientists around. So there's lots of people to help you. When you're in your trusts, there are now over 100 trust lead scientists. Seek them out. Go find out who they are. And quite honestly, if you don't have a trust lead scientist, then make yourself one. Just you step forward and say, I'll be the trust lead scientist. Seek out departmental educational leads. They may be nurses, they may be HPs, they may be medics, but go and find them and tell them that you're a trainee and you're now in their hospital. Seek out alumni of this program, and we're going to see over this year if we can maybe start to build up a mentorship kind of group to help you. So watch this space. And be prepared to be a pioneer. Seriously, you're going to find in your trust that there's people who have paved the way before you, but you still are very much a pioneer. So be prepared to be a pioneer. I suspect all of you are, because you're scientists, and scientists kind of generally like finding out things new, and they don't mind being ahead of the curve. Contact us at the school for support. Contact university for ideas and support. Expect challenges, and stay positive.
I was offered to take part in a research project. So I was kind of told to take part in it, but I said yes, and that has really just led me on a journey for the rest of my career. So I took on this research role in Oxford. It was only a year at first, and I was a bit nervous about what I would do next, but luckily I then got a permanent position. And during this time, I thought about what did I want to do next? Did I want to do the HSST? Did I want to just take some time and chill out for a bit, which is okay to do. A lot of us have come straight through doing our undergrad, then on to the masters, the STP. It's all really hard work. If you need to take some time out to just work and live your life at home, that's fine. Nobody be nervous about that. So I just have some hints and tips. Network. Like Gemma said earlier, I just mean socialize. Be sociable with each other, get to know each other today, exchange numbers, exchange Facebooks, and also do that in your lab. You're going to go to your lab, and then you're going to go off to Manchester or wherever you go to do your MSc training, and then you're going to go on your rotations. And you might feel like you don't know people in your lab well enough, but just tell them, I want to be invited to the pub. I want to be invited to any leaving dues. It's really important that you keep that relationship going, so then you're not so scared to come back after your rotations. We do a great thing in Oxford called beige lunches, where everything is beige. It's the best food ever, and I just made sure that I attended every single one of those beige lunches.
And the last question I want to ask is, can you give some more specific tips about what I really liked what you said was that, you know, the first year is not a dawdle. The first year is actually quite tough. Do you have any little tips like about how to make sure you get all your competencies done?
Yeah, so the first year you're rotating, I would say get the competencies done for that rotation as early as possible before you leave. I wasn't the perfect STP. I got most of them done, but I got halfway through my second year and realized I had a biochemistry competency that I hadn't done. And it was so hard to switch my brain back from immunology to biochemistry to complete that. So just keep up to date with them. Keep talking to your training officer. If you're finding some training officers are very new, some departments don't know what an STP is. I've been through all that. You guys should experience that less than I did. But just make sure people know who you are, what you need from them, and what they should expect from you. So you really just want to keep pushing away so that when you enter your second year and really start in your specialist area, you don't need to think about those first year competencies ever again. They can just be a little green line.
The piece of advice I'd probably really emphasize is that you'll pick up loads of technical scientific knowledge, but you also need to think about building relationships with colleagues, because I think that's going to be equally important, as Berne was saying, going forward, in order to change the system and make sure that as clinical scientists and broader healthcare scientists, we get that kind of recognition at higher levels in the system.
And I thought it was really interesting when you said you met system barriers. Want to give us an example?
Sure, yeah. So, I mean, funding is always a key one for us. And when I was in my department in Guy's and St. Thomas's, there was a real lack of funding for maintaining equipment across the trust. We had 55,000 pieces of equipment and very little money to do anything with them. So actually trying to build a business case and bring it to our trust executive to say, actually, we need to completely remodel how this is going to be funded. I mean, that was a huge struggle because we didn't have those links higher up in the organization to be able to lobby for our little piece, because you have all these competing priorities at that level, and quite often clinical engineering and medical physics don't have those, you know, the big consultant leader that can go in and bang on the table for what they want. So that was one where we managed to eventually overcome it.